I think some of that is the lens that we look through a patient, and we're looking at health and wellness and things like that is different than a traditional dentist, I'll say. We're trained in a reparation mode, I say, where we're trained to mechanically treat a tooth. In reality, we should be, and many are, trained to be healers.
Hello, everybody. This is Dr. Kevin Connors. Welcome to another episode of Connors Clinic Live, where we have a very special guest. Partly because all of my patients over the years have asked us about, using biological dentistry. Obviously, we're very big into that. I have a lot of blog posts and writings about mercury in your teeth causing issues and dental, hidden infections causing issues with breast cancer. So we're very big into biological dentistry, and I have a great guest who's a fantastic biological dentist. Yay! Cheers all around. Dr. Cody Kriegel is in Iowa, but he's going to give you some of his insight in practice and why he does what he does. So let's turn it over to you, sir. Tell me your story.
Yeah. So as you stated, I'm a dentist in Iowa. My story, I find as I get to know colleagues in this space, not only biological dentistry, but in functional medicine, integrative oncology, different areas of expertise in this realm, we all have a story or something that got us into what we do. And some of us stumble into it, but there's a kind of an aha moment or a turning that happens. And for me, that was with my mother. I was trained in dentistry the same way as everyone else is trained in dentistry. We're all trained arguably the same way, taught the same things. And I've always been into health and wellness myself. I've always enjoyed that and regenerative medicine and kind of those camps and longevity. And I started to realize that things just didn't add up in dentistry like I was told. And so I began to do some digging on different things, such as amalgam, fluoride, hidden infections in jawbones, things like that. And long story short, my mother was a nurse. She's retired now, but we were very close. And I flew her to a mentor of mine, and we treated her together. We removed a root canal and treated some areas of her jawbone that had some kind of chronic inflammatory pathology. And she had heart palpitations her whole life. And no one had an answer for why she had heart palpitations. And within about usually like 2 to 3 days is what it was for her, they went away, and they've stayed away. And we're going on 5 or 6 years now. So that was a turning point for me of, hey, there's other things going on here that maybe dentistry as a whole is missing. And so then I went down a rabbit hole, and I'm so far in the hole, I can't see the top anymore. So
you have to kind of change the way you're going to. So when you went down that rabbit hole, were you still in school or were you already out practicing?
Yeah, I was out. I was out practicing. I had what I call pause for thought moments along the way, which was basically, if amalgam, because of the mercury content, about 50 to 55% of amalgam is mercury. If that's deemed a poison, when we remove it from somebody's mouth, we have to separate it from the water systems. It's a known, some studies will say 10x the toxicity components of lead. If that's a problem, why is it safe when it's in somebody's mouth? And so there was moments of like that where I was almost too logical. I was told it was safe, I was told it was effective. And whenever those two terms are laid on something over and over and over and over, it makes me question whether they are safe or effective.
Yeah, we're told a lot of things by our medical establishment and the government that is not true if you think for yourself, right?
Yes, and I think that's what my God blessed me with. At least I'm not always open-minded, but in a turning point in my career, I was humbled enough by him to just say, hey, what is this other side of this? And to keep an open mind. And pretty soon, there's a ton of studies and literature to support that these are not good things, but we're never told those things or we're never shown those things. So we have to go digging on our own. And God led me down that path pretty quickly.
Now, when you label yourself and brand yourself as a biological dentist looking for these things, I would think that you get a lot of people that come to you because they have other health conditions that they want to investigate whether they're tied to dental issues or not. Is that true?
For sure. Yeah. So the lens that we look through now in dentistry, of course, we're looking at the mouth and in a sense, the head and neck in a sense, but obviously the mouth. And our patients come to us usually sick. They're struggling with their problems. Sometimes it's one or two issues. Sometimes it's a plethora of things. Typically, they're referred from practitioners such as yourself, functional med docs, some chiropractors. So typically, most people are coming to us working with a provider that knows, hey, they're struggling with XYZ things from cancers to thyroid issues to gut issues to catch-all terms like fibromyalgia, things like that. And we are kind of looking at the mouth and saying, hey, I just want to get the mouth healthy. I can't cure you of any of those things, and we never promise that. But what we find is there are a lot of things, whether people are using on a daily basis or things that are what I say permanently installed in their mouth that can be driving ill health for people. And we just seek to remove and replace those things with things that are compatible. And a mentor of mine has a coined term. His name is Miguel Stanley. He's a very prominent dentist in Lisbon, Portugal. And he says, no half smiles. No one deserves a half-hearted smile or half-hearted treatment. People deserve to be healthy, and they deserve at least to have the opportunity to be healthy.
So let's get into some of those things that you said that you find that can lead to other morbidities. Sure. Maybe in whatever order would be great, if it's like most common or whatever.
Sure. Yeah. Yeah. So what I kind of have termed them, interference fields, things that are interfering with somebody's optimal health. And those can kind of come in umbrella categories, but I kind of boil them down into, of course, bacteria. And so we're looking at the microbiome, and we want that in balance. So of course there are pathogens in there, but there are also a lot of good bacteria. So we want to look at the microbiome and say, and kind of tease it apart and say, is it in balance? Is it in harmony? Or is it, kind of haywire? We look at root canals, of course. A root canal is technically a dead tissue. We are the only branch of medicine that deems it safe and effective to leave a dead tissue in somebody and call it a success. Do I think every single root canal out there needs to come out of every single human being? That's a tough question. But with the advent of CBCT technology, we find that they are quite often chronically infected. And there's
Tell me a little bit about that for our listeners.
Sure.
What's that technology that you use to see that?
Sure. Yeah. So CBCT, a lot of people will call it a 3D cone beam. What that is it's a machine that will put your upper and lower jaws, and sometimes your airway, depending on the machine being used in the field of view. And it's putting it in 3 dimensions, so we can look at every tooth from every angle. When you go to the dentist, if the dentist just looks in your mouth, all you see is the tops of your teeth. You don't see your bone beneath the gums. You don't see the roots of your tooth. There's a lot that's hidden, or I'll say under the hood. And so a cone beam is really, in my opinion, is completely 100% standard of care. You cannot be doing the best dentistry possible and treating people appropriately without assessing everything under the hood. And so that allows us to put the upper and lower jaws in 3 dimension. We can look at all the bones, the maxilla and the mandible, upper and lower jaws, the teeth, the roots. We can see if there's any infections in chronic inflammatory infections in the jawbone from previous treatments. We can assess root canals and see if they have a hidden pathology or a hidden infection on them. So I really feel like that is a standard of care. I feel like it's a technology that needs to be in every dental office and needs to be taken on every new patient to properly assess.
Now that's different than just going and getting X-rays. Correct.
Yep. Yeah. So your typical set of X-rays is to look for cavities, which of course needs to happen. But this is much different than that. Yeah. So we still take those X-rays, of course, your routine radiographs called bite wings or periapical images. And then we take a cone beam as well to be able to kind of lay all the data points together and kind of assess.
Oh, that seems to be something that, I have to have this discussion with patients a lot because they'll say, well, because when I test with kinesiology, we find out, let's say, a person's breast cancer is tied to their teeth and an infection. It's not uncommon that I have a person that already thought of that. And they say, no, I went to the dentist and he did a full set of Xrays and he didn't see any infection. And I have to go, okay, well, that's not good enough. You have to go deeper and you have to get to a biological dentist that's going to go deeper. Now, you said the cone beam should be, I think that word you didn't use because it isn't truly standard of care. It should be standard of care according to your opinion, because just going and getting X-rays, you could miss infections. You're not going to see those infections unless they're blazing infections.
100%. Yeah, and we have that quite routinely where people will come in and they feel like something's off, or they're coming in on a referral. They've been given a quote unquote clean bill of health from a local dental clinic. And I think some of that is the lens that we look through a patient, and we're looking at health and wellness and things like that is different than a traditional dentist, I'll say. When we look at the teeth as a means to chew and function, that's great. And so we're trained in a reparation mode, I say, where we're trained to mechanically treat a tooth. In reality, we should be, and many are, trained to be healers. Right. And so why would we put in something that would harm our patient's health? We wouldn't use those materials. We wouldn't do those treatments, or we'd find newer ones, different ones. And dentistry is advancing at light speed. So we should be looking at the health of the human being as our first tenet of treatment. And then how do we achieve that, with what we're in charge of, which is the mouth. But you're right. I mean, to get back to your point, routine X-rays miss a lot. And so a CBCT will uncover, I just had one the other day, where we looked at all the images that were sent over. But when we took a cone beam, a gal had a root canal that didn't hurt. I think she had an intuition though. She just, something's off. Something's in my way. I can't get past something. I can't figure out what it is. And her root canal was infected and it went up into her maxillary sinus. So not only was it infected, but it had blown a hole up into her sinus, and she had a lot of sinus problems happening. And that's a problem, obviously. Yeah. So,
and you made a point there that it didn't hurt. And a lot of people think that if they don't have pain or they don't have symptoms in their mouth, how could my other issues be tied to that? And I'm sure you probably deal with that on a regular basis.
Yeah, I mean, it's arguably what, anecdotally, 80% of what we do is, most cavities don't hurt until it's too late. When they start to hurt, then you get into a dichotomous situation of where you either have to take the tooth out or you choose to do a root canal. And that's a whole nother conversation. But, what I like to say, or what I use when I speak to patients is things that allowed me to grasp along the way certain concepts. And somebody once told me diabetes doesn't hurt until you get neuropathy or something, and you end up losing a foot or a finger or whatever. Cardiovascular disease doesn't technically hurt until all of a sudden one day it's too late and you have a heart attack, God forbid. So a lot of the chronic inflammation issues, that's our battle. That more than I do. That's our battle of this day and age. And it's hard because they're not acute, so they're not driving people into care until sometimes it's too late, or you're trying to backpedal, and that's a hard game to play.
Okay, I interrupted you. You said we're going over those things that that people have. You said infections, so I'll let you carry on from that.
Yeah, things that we're looking for. Yep. So we're obviously looking for infections, and I think you have to be kind of trained a little bit differently to see those in some of these locations. One of the layman's terms that people use is a cavitation. I was very humbled to be a part of a recent paper, white paper on cavitations that is a very interesting chronic inflammatory burden, one that we need to know more about, but one that we do know quite a bit about. And so we're looking to make sure people don't have those. Obviously, we mentioned root canals, and then metals. Metals in general, amalgam is primarily, I would argue, the worst. But there's no need to be putting metal in people's mouths, period. And as people struggle with heavy metal issues, the environment of the mouth is very harsh. So we see metals will corrode, rust and corrode. Of course, that activates the innate immune system. So you can almost get like an autoimmune attack on those metals. And then, of course, as we all know, EMF is becoming much a problem, or has been, is getting worse. And we have studies to show. I mean, when you put a cell phone up to somebody that has an amalgam, you see more mercury released from that amalgam. Or if you have a metal implant, that you will heat up the bone around that metal implant while you're on your cell phone. And they're just an antenna, is kind of what I kind of look at it as. And so we're getting into some dangerous ground as we move forward with some of this stuff.
Yeah. Is that a primary thing? Where would you say, that it can be difficult to remove somebody's, mercury fillings? I've had patients that look inside their mouth and it's like, oh, I would feel sorry for the dentist that would try to do this. It's just, they grew up in an era that's what all their dentists did. And they just overfilled, compacted this tooth. And it's like, you can hardly see any white. It's all silver. And I don't, is there a time where you just pull the teeth and go to dentures? I mean, I don't know.
Good question. Rarely do we have a situation where we can't save the tooth. We can work with a lot in dentistry. And I think my approach is that God made teeth perfect. In fact, I feel teeth are a perfect example of how we have a creator. They're too divine. They're too well intelligently designed to be otherwise. But when you then respect a healthy tooth for what it is, you don't want to remove. Let me say it this way. You want to save as much of that healthy tooth as possible. And in today's world, with the advancements in materials, the way that we can bond or adhesive protocols and things, we can do a lot with very little tooth. So I kind of feel, and honestly, the days of doing a full cap or crown are over. We don't need to be doing that anymore. You can save more tooth structure and do much less invasive treatments and keep teeth longer. If you feel that way, if you put it that way.
Okay, good answer. Here would be a question that is on everybody's mind, I think, is that if they do have multiple, mercury fillings, how many sessions? I mean, how many in each session of removal and replacement? How many teeth could you do? I suppose it depends on how bad it is and stuff, but in general, could you give us that?
Sure. Yeah, those decisions, at least I can speak for the way that we do it in our clinic, are typically made all of our decisions are made with a patient, not over a patient or around a patient. We're kind of talking to a patient primarily of, this is what you have, this is what that we feel needs to be done. How does that feel to you? Does that resonate with you? And I think the one thing that dentistry is bad at, and maybe healthcare in general, is we talk down to patients. It's my way or the highway. And I don't like that. We're treating human beings. And so we kind of have a good conversation.
You happen to know some oncologists or something?
Yeah. It's just weird. I mean, when you, and again, the last thing I want to do is speak ill will towards my profession or others. But at the same time, I've seen some very amazing people do amazing work, and their outset is, hey, I'm treating a human being. I'm not just treating a mouth, for example. For me, I'm not just, and not just a kind of a head on a stick here. And this is a human being we're dealing with. And so we have a good kind of rapport with the patient on, this is what we have going on. I would recommend X, Y, Z. How does that feel to you? Those type of things. And sometimes people are traveling a long ways, whether it's a long drive or by plane. So that dictates some of that treatment in our clinic is the traveling patients. But the front answer is I would prefer to remove as much as possible in one session. And I know that that's debated a little bit. I feel if you're doing the appropriate amalgam removal protocols, you're protecting a patient from that exposure. There's pre and post rinses, and there's other things that we're working on with laser therapies and things kind of around that to support, the system of the patient. I feel the more burden you can remove from a patient at one time, anecdotally speaking, we see bigger improvements from patients when we can remove as much as possible in a session.
Yeah.
The other side of that, not everybody can do that.
Right.
And some people are very delicate. Their systems are in total hyperdrive, sympathetic overdrive. They can't handle that. So in those cases, we will break it up by quadrant or sides of the mouth and kind of slow it down a little bit.
Yeah. And my struggle with, supporting that is, we typically use chelation therapy around that if somebody's need those fillings out, and you don't want to use heavy chelators if the person still has mercury in their mouth, so you're trying to balance that.
Sure.
I do know that we'll get people after this interview and now after speaking with you, because we'll put your information up on our website, that maybe live in Virginia or live in San Diego that want to come see you. Is that possible?
Absolutely. Yeah, we've seen a lot of flying patients. We try to be in touch with them quite a bit on the front end to give them an idea of what's possible, or what, we like to get some information first, of course, that goes with any clinic, but we like to put together sheets as far as, hey, we can help you on where to stay, places to eat, things like that. So we do take that serious. It's an experience for a patient that we pride ourselves on. But it is possible. And so that there's my staff is pretty highly trained on just treating people like human beings. I keep coming back to it, but we have that patients coming in, and it's because no one in their area listens.
Yeah.
I'm sure you have that too. Sometimes
that's sad, isn't it? It's just really sorrowful. It's like, is this the society that we are creating now? That doctors are just a bunch of paid technicians for the pharmaceutical industry. There's no more Marcus Welby type. You're too young for that, but there's no more that type of care. Even on modern TV shows, you see hospital situations where the doctors are really caring for the patient and taking time. Nope, they are just swamped with. I don't blame necessarily the doctors. They have to see 500 patients, and it's like boom, 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 boom. They don't have time to even care.
I couldn't agree more with that, and I think people go in with the right intentions through school, whatever it may be, and they kind of come out robotic. And sometimes maybe appalling of systems that are in the higher places than we know. And it gets tough because the systems are so broken. Like you said, I personally when I came out of school, I did not open my clinic right away. I knew that was a dream and a vision of mine, but I had to get my ducks in a row. I needed to kind of get clear on what my vision was for dental care and treatment and how we wanted to go about it. And luckily I ran into people that have helped me from all over the world, and have become good friends with, and I've gotten help from them on protocols and learn things. But I was in a situation where I was being asked to do, for example, more crowns. We have a quota to hit, or we have production goals. And it felt horrible to me. And I kind of came into a crossroads for me where it was, I went to school for 8 years, studied my tail off, showed up every day. And this is what it was for? Like, I'm burnt out and I'm 6 months out. Like this can't be right. So I did have.
You're almost afraid to think for yourself.
Yes.
Yeah.
Yes.
Practice reasons for, all these, you're not following standards of care. You're not, it's sad, but I mean, this is across the board, not just with medicine and dentistry. It's in our whole society. We can't, we're shamed to actually be thinkers. And, I guess it's a sign of society's collapse, I guess, unfortunately.
Yeah, I agree. Hopefully, there's still lights in it. Obviously, you're one. We're trying to be one. But it's hard for patients sometimes where, I think when getting back to a travel patient, it's like we try to help. Sometimes we try to help a patient find somebody that we know and trust closer to them that we feel can help too. And at the same time, sometimes it's just, no one's listening to them. And once you listen to somebody for the human being they are, then there's a trust there that we earn, that we hope to earn for people. And then that's it's what we're called to do, help people. So,
well, thanks, Dr. Cody. You are a bright light in seemingly dim world sometimes. So I appreciate what you're doing. We're going to have all your information and all your connection information on this video, and I'm going to get it up on our website as well so people know how to find you. Any last words of encouragement for people?
I think I would be remiss to say that you are a light as well. And I'm very thankful for people like you doing what you do. You know, this is a team effort to help human beings, you know, improve and get better and heal. And I'm always reminded and thankful that there is a team of us. We might not all know each other, but as we start to know, there's power in numbers, and there's healing in that. But yeah, thank you for having me on. I appreciate it. Anytime to talk this stuff, I could do it all day. So I appreciate your time.
All right, we'll have you on again.
Thank you.
All right, bye-bye.